Thank you. Thanks a lot for the introduction, Usha ma'am. Thank you everyone
Yeah,
for the
Swarna,
opportunity.
I just got it. Can you get me? Can you see me? Can you see me now? I can hear what's going on now.
Yeah, we can all see you. We can hear you, but we can't see you. Video on.
Okay.
Is that Vimla?
Yeah.
Yeah.
Great.
Hi, Gayatri. At last.
At last.
No, you are right on time. Geeta, you can take the screen share. I have gave you the rights.
Thank you. All right, so the time given to me is very less, so I am directly jumping in. I'm sorry, I am Geeta Magesh. Kindly request not to change my husband. All right, okay, so here I go. Can you all see my screen?
Yeah.
All right, thank you. All right, it's a very, very important topic, irrespective of the age. But given the constraint of time, I am restricting to few things. But in case if there is anything that anyone wants to connect again, always welcome, because I'm also a part of Roshni. Okay, so for the next 20 to 25 minutes, we will quickly see what we are going to do. You all are volunteers doing a wonderful job. So I don't think so it's a requirement, but still the topic should sensitize us a little more, help the person who is struggling with relationship issues, how to handle rejection and fill the void after that phase. And of course, discuss anything related to this topic. Okay, so to begin with, I thought the best thing that we can begin is understand what are the myths of love. We are so tuned to our Bollywood, Hollywood movies, greeting card companies, and novelists, and they have maybe not mentioned the truth of how to handle ourselves when we are feeling unloved. All we have seen is the beauty of love, the beauty of the perfect partner. You know, the nice lines, you complete me. And love should be always easy. That's what we understand when we see the movies. And we always see everlasting love because most of the movies end so beautifully. But is this the fact? You may be having callers who are struggling in relationships, and it might be because they are living somewhere with this myth, always thinking about the perfect partner. Again, it's thinking about the perfect partner. And when we are thinking about the perfect partner, it's an internal belief. It is again a negative judgment, I should say, towards our partner. So we are caught up so much in that, we forget to see what we actually have. And we always say, wish my partner could be this, wish he could do this. So, you know, it's like he or she is actually doing that love to you, but you are imagining him or her bending on knees and telling you, I love you. Maybe he is doing it in the other way by helping you in the kitchen or taking care of kids or something like that. And again, other thing, you complete me. A fantasy term, but it's very important to tell people that you are already complete. You are independent. And that is the reason you're looking for a relationship or you're in a relationship. And love should be easy. Yeah, looking at all the movies, we feel it. But just imagine how will it be easy when we are having people with different thoughts, feelings, interests, expectations, maybe religion background, upbringing, belief system, style of dressing. The list is too big. And keeping all this, how can it be easy? So we wish again compatibility. Yes, it can come, provided we are okay to compromise a little, openly communicate and accept our differences. So it also requires standing up for yourself and telling no where it is not possible. So as long as you expect your partner to think and feel the way you want, then it's nothing but disappointment and frustration. So that's about the Myths about love. Uh, this is again one interesting thing. Feeling and action of love. It might be seeming, or it's just a sentence, but feeling and action is entirely two different words. Feeling is an emotion which can come and go just like the season, but the action is what matters. It can happen that I'm really feeling loved now, and for some reason we had an argument, maybe today evening, and we are actually yelling at each other. Is it still okay for me to go and hug my husband? Can we do it? What do you all say, team?
Yes.
Yes, of course, we can do. Irrespective of what my feelings are, I can still do a different action. That is something which is within my control. And that would ease the face. Whatever argument it is, it will still, make me feel comfortable. Reconnecting to your values. Whatever background we come from, we have a strong values deep inside us. The person we want to be, maybe we want to be really an honest partner, we want to be completely truthful, we want to be hardworking, share the burden, and so many values. Are we actually doing it? If not, it's important to quickly remind and reconnect to those values. Remind ourselves the partner I want to be, irrespective of what he or she is, how I want to be. How am I looking at the relationship I wanted? It's very common for anyone to have a beautiful fantasy about this is how my relationship should be. It is important that we work towards it, irrespective of how the partner is there. What is my go in that? What is my say? So that's about feelings and action. They are two different things to do in a relationship. Having said all this, there will definitely be problems, and we are again worried. It's very common when there is a problem. It's difficult. We are not sure what we should be doing. We need to understand whether we are actually planning to construct a house or have a baby. It comes with maintenance. Same goes with any relationship. You want to have a baby? Yeah. Don't forget, there is diapers issues, there'll be complaints from schools, maintenance, everything. You want to have a beautiful house? That big is the maintenance. So why not in relationship? So it's absolutely okay if things are at times not going well. It's absolutely fine. It's not wrong. But that is the situation when your mind encounters a problem and it searches for an immediate solution. We are humans and we want solution. A solution which is not painful, not difficult and easy. And when it is not possible, we want to get out of that problematic relationship. So based on the situation, you decide. Generally, any problem, this is what we do. We leave, we stay, and change what can be changed, meaning I try to change what is in my control. And 99.9%, it is nothing but me which is in control and not my partner. The third thing is stay and accept what can't be changed. Acceptance is a very, very big thing which has to be learned and doesn't happen overnight. So, based on the current life circumstances, location, income, your status, children, and all, even keeping the factors of age in view, you decide whether it is better to stay in the relationship in a long run, or would it be better if you actually left? It's a conscious, rational decision which needs to be taken. Emotional decision and practical decision, in between, there is something called rational decision. When I'm really depressed and I'm taking a decision, of course, it's emotional. So, people say that we are not supposed to take decisions when we are really happy or really sad. Same implies here. So, most of the callers who might be reaching, or where even I start doing therapy, is who stay and who actually give up on relationship and do things that make it worse. I'm staying in the relationship, but I give up. I don't talk to him. Or I do things which make it worse. Maybe I am staying under the same roof, but it's more like sleep divorce. We are there, but we are not sleeping together. Or maybe I'm not talking to him, or I'm not talking to his relations. I'm like cut off from the world. So this is actually going to make the situation more worse. Any problematic situation, I mean, most of the time, these are the options which I see. So having said this, where we stay up and make the things worse for ourselves, we reach here. The journey of heartbreak begins. There is anger, there is aggression. Anger is an emotion, aggression is what you're doing physically. You feel you have a damaged self-esteem, your confidence goes poor, you become self-critical for everything, you blame yourself, you feel guilty, you feel unloved, and you isolate yourself, feeling lonely. But one thing which has to be understood here is these all feelings are self-imposed. How much I feel, it all depends on how much I feel at this time. One important thing which I tell every client of mine who is coming up with a breakup or rejection is, please understand, you have not been rejected. The relationship has been rejected. The guy or the girl has already proposed, means it's not you. You have been going very good for 6 months, 1 year, 2 years, whatever, which means you're already accepted. Rejection happened because maybe the chemistry did not go on. Maybe your compatibility is not great, and it's actually good that you'll have realized before going too far. So this is one thing which we need to convey to the caller, which I suggest is the relationship is rejected and not you as a person. So those are two different things. All right, so we will just in the next coming slides, we will see how we can handle these situations. Okay. Yes, let breakups not break us, because there are two different things again. So when we talk about heartbreak, or we are breaking up and rising up, it all depends on the way we are having our coping styles, our individual history, our family history. See, when I'm talking from a psychiatric or a psychological point of view, these all will matter to a very great extent. My current life situation and how I manage or mismanage the recovery process. Am I a person who's really anxious, dependent? Then my coping style would be different. Am I a person who is quickly given whatever I want? I really don't know how to cope. So my coping style would be poor. And of course, it depends on my history, how many rejections I had, what was my childhood, or what were my previous relationship, and how is my family history. Am I a person from a broken family? All these will matter. And currently, what is my life circumstance? And the most important thing is, how am I managing or mismanaging the complete recovery process? So this is what will be the background, which we need to maybe, given a chance, if you all dig this a little bit, it gives a clear picture to understand in which way we need to go. Okay, and then there is something called broken heart syndrome. When I was talking about sensitizing, we see love failure as a rejection, or we see that's a very, very, sad stage of life. To speak about what goes behind broken heart, you all will be surprised to know that when we are treating, the way we treat a person who is addicted and the broken heart is almost the same. As long as you are in the relationship, you are getting addicted to it, and the withdrawal symptoms would be really, really difficult. So a person coming with addiction and coming with relationship failure will be having the symptoms absolutely the same. The person whoever is calling you with relationship issues would be having poor immune system. What am I speaking? Yes, it's the truth. When we are having a broken heart, we are really stressed, going through a range of emotions, and this disturbs our hormonal balance. And this lowers the functioning of the immune system. And that is whenever you all see that you all are having a lot of stress in life, it would be very, very easy for you all to catch cold, flu, or anything, because the functioning itself is come down. A person who is in a poor relationship would be not able to think straight, would not be having a clear speech, would not be able to make good decisions. A good example which I can give you is last week when I had a case who was coming up with a relationship issue. She has booked the appointment at 11 o'clock, and 11:15 she calls me up standing in front of Grand Kakatiya, telling that I'm not able to reach the address. And then she starts crying. For what? Because she was not able to get the address. How far is Grand Kakatiya and RCC? It's hardly maybe 5 minutes of distance by walk. She was not able to even handle the simple fact that she did not get the address at that point of time. There are many such issues. There might be people who just wake up in the morning, open the fridge, and just see that there is no milk and don't know how to react. So their functioning is so impaired. And when there is cognitive impairment, their general functional impairments would also be very common. They would not be able to work properly, study properly, cooking would be a problem, maintaining hygiene also would become difficult. It would not be a surprise when I say that they are the people who lock themselves, are always on the bed, not having bath for 1 or 2 days, not able to eat. So they are calling from that background. All right, and the most important thing I wanted to say is this is a process of grief. When there is a death of a close person in our family, we have all extended people to support us, our close relatives, family members, because it's acknowledged. And they say, oh God, you have such a loss, you have lost your close one or whatever. Sadly, this is not sanctioned process, but it is a similar grief. It happens in both the cases. The grief when there is a death of a person and the grief when there is a breakdown in relationship is almost similar. The stages are similar, but sadly, the support system is not similar. So this is something we should, make ourselves even more sensitive when we are talking to the caller, trying to put ourselves from that point of view. So what are the healing agents when we know that this is the situation? Of course, we cannot ask the society to support us in the same way when there is a death in the family, a relationship breakup. Definitely the society would not give me. I mean, if I'm working and I say that I am having a heartbreak, please give me 2-3 days off. Will my boss give me? What nonsense you're talking? That is what would be the first response. But if I say that there is a death in my family, they would immediately respond. So the healing agents. Friends, family, your study or your work, your social life or your community support, they all form your supporting system. There are only two healing agents. Very simple for this problem. One is your support system and one is time. Of course, time is not something that I and you can control. But these all things are in my control. Just imagine from this ropes, if one rope is broken, and that is my love failure, I'm still strong enough. If I am investing in other relationships or other support system, if I'm still able to communicate with my friends, I'm still able to maintain the same relations with my brother, sister, mom, dad, or whatever, if I'm still able to focus, may not be that great focus, but study and work, continue that, and involve myself maybe a little bit to socialize. I'm not telling that you should be going around pubs and enjoying and all, but involve in doing something socially, talking to friends, going out with your friends for some time, have a tea break. When there is a love failure, you see that the person is completely cut off. These all elements are not there in their life. They actually are something like they are from a different universe, and they are not okay to accept that life of everyone else is functioning normally because they are cut off. So this is one thing which we need to remind them, because we may not be in a position to mend or repair their broken relationship. Instead, invest in other things that can make you stronger. So this is one thing. This is one favorite thing, cyber stalking. Most of us, once our relationship is broken, we try to stalk them. And now in this technology, we stalk them at every moment because it's always in our pockets. We always wanted to see what they are doing, if they have restarted while I am stuck, while I am having sleepless nights, what is she or he doing? And what are we doing by this? We are actually reliving the moments. It is very important to suggest or give the option to stop doing this. Immediately unfriend, unfollow, whatever the names are. Even after unfriending, our mind doesn't stop there. We still wanted to find what they are doing. And we try to find some access point, some brother, sister, some common friend, and again try to barge in. So it's important that we erase even those access points. And there is nothing wrong if you are not on social website for few days until you are well. So if it is that important that you're not able to restrict yourself from unfriending or erasing all access points, deactivate your account for some time. Because until you are well, nothing can be well. So I would suggest just burn the bridges and we will start fresh. So that's about cyber stalking and giving a closure. You may be having callers who keep calling and telling and explaining what has happened and how did it happen. They explain so much in detail that he has broken my trust, and within such a short span he or she is already in relationship or whatnot. It is very important to bring them to why did it happen. Bring them there. That is what I do. Once we know that, it would be easy to understand. And once we know why it is happening, let it be my mistake or his, we know it and we leave it there. And the way I would suggest closure is, I would no longer have him as my dream man coming on the white horse. I would not idealize him any longer. I don't want to still dream about this is how my perfect man should be. I would stop doing that. And how can I do it? Make a negative list. Write all the reasons why my relationship went for a toss. Yeah. He has done this to me. He has done this to me. Whatever. He did not support me this time. This is how he actually dresses dirtily. Red and yellow is his favorite color and whatnot. Whatever you feel is not right. There will be many things. But we do not look at that when we lose the person. That happens the same even when there is death in a family. There might be many things that the person has done right and wrong. We always talk about the right things when we lost the person. That's our tendency, human tendency. So it is important that we remind the person to make that list. And whenever they are sinking back there, we'll tell, hello, you have the list on your phone? Check that list so that you feel better. Okay. So that is one other important thing. And giving a closure, sometimes it's always hanging. You don't know the reason why it's a breakup. So I would say give your reasons at that time, because no reason would be happy for you or satisfying. So you give your reason, but close it. That is another thing. And we do a great job by avoiding. We avoid our feelings by not going to the place where I went with my boyfriend or girlfriend before. I can't go to that movie theater again, yeah, that reminds me about him or her. I can never go to that restaurant. I can never play this game again. And we withdraw from so many activities which actually complete me or which are a part of me. I had a client who was district level player of badminton. And the person who actually started teaching her or playing with was her boyfriend. And she reached district level and she says she doesn't want to play badminton because it reminds me of him. So there are so many things which we actually want to do, but we are scared because that reminds. But when we are trying to avoid, our grief becomes bigger because we are again fighting. At this point, it's important that you start somewhere. Go back to the same place. Make new associations, new memories. Go for a walk. Maybe this time you can have your friend, your neighbor coming for a walk with you, and you slowly cultivate. I'm not saying that it would happen overnight, but you'll slowly come there. And they would be constant reminders, but it's important that you trash it into the garbage and make your new associations so strong that compete with the old. Yes, healing starts in mind. When we get hurt, do we tell our body, our bone, heal now, white blood cells, please release? We don't do that. It happens automatically. But when we are hurt, can we tell our mind, heal now? We can. So healing starts in the mind. The only thing is, it takes some time. It's important that you live that little phase of rejection. If this is something which is well followed throughout the world, anything grief period is generally 6 months. Within 6 months, a person should be getting out of grief. Let it be relationship, let it be death, loss, or anything. We call it 6 months. Post 6 months, if the person is still having trouble having a normal life, then we call it complex grief and requires treatment. So giving some time to heal is very, very important. And during that time, it's okay to acknowledge the way we are feeling. And the best thing what we do is we ruminate. We keep thinking and thinking. We have the thoughts and images always flashing up. And when we are thinking, the pain becomes fresh, always fresh on our minds. But it's important that we decrease the time that we spend on these pain, the thoughts that we do, the images that we flash. So we need to control the time that we are using on this. How are we going to do? We'll just see another slide for that. And we start having new habits. Something new that we begin with then the healing will slowly occur. And most importantly, say goodbye to the person and the relationship that is still actually not there. It's just that you did not say goodbye. So it's important you say the final goodbye to the person who's actually not there in your life. And the most important thing, the most important is having compassion for self. When you're having self-compassion, it treats most of the psychiatric issues, depression, anxiety, bipolar disorder, anything about the psychiatric world, we first ask to be compassionate. Because if it's the same relationship issue which your friend has told you, the way you would handle or treat your friend is entirely different. But when it comes to you, it is more with guilt. I am wrong. I take the blame. Why being so hard to you? So how do we begin? The very first thing is start being compassionate to others. Once you start being compassionate to others, you learn to be compassionate to yourself. I always suggest my clients to just make one compliment to one person per day. It will definitely make the person feel nice, but it's more important how it makes you feel. Respond to yourself with kindness. The way you treat yourself, if you can say those thoughts aloud to your friend, Vichara, she will, cry. If you say you are wrong, you are the person who cheated and all those, the way you tell it to yourself, you will not be able to tell it to your friend. And when you tell that loud, you know how you're actually treating yourself. So at times you can put your hand on your heart and say, it's okay, I'm there for you. And it really makes sense. I do it. That's self-compassion. And in spite of doing all this, there would still be some voids and some fillings still required. That is when we need to do a little more. Begin with a new hobby, have a new learning. You can start a new course, sign up for something new. There are so many online now, chess classes, mehndi classes, cooking classes, or something to add up to your academics or career, learning some course on edX or anything. Activity schedule. Prepare a schedule for yourself. I mean, irrespective of whether it's a relationship problem or anything, having COVID time, we don't have a schedule for ourselves. That is one poor management of ourselves, which commonly happens. Have a schedule and see how much you have achieved. That itself should reinforce you. Have a schedule that I get up at 6 o'clock, 6 to 6:30, I fresh up, 6:30 to 7, I go for a walk, 7 to 7:30, I come, I have bath, 7:30 to 8:30, I cook, 8:30 to 9, I'll have my breakfast, and so on. And in this activity schedule, if you think you still did not grieve enough, you did not cry enough, have a worry time. It might be sounding funny, but if there is something really still bothering you, somewhere between the day, maybe around 4 to 4:30, give a worry time. Instead of worrying right from morning till bedtime, tell yourself, hello, this is not the time to worry. The worry time is 4 to 4:30. And just worry only during that time so that your rest of the time is productive. And mindfulness. There is not, any research which is done more than mindfulness in psychology or psychiatry. Being mindful, accepting the situation the way it is more important than trying to dig everything. You can suggest meditation. If there is anyone, you can always help them with techniques of meditation. There are various meditations. Because I learned it from a Buddhist monk, I'll say there is sense meditation, eating meditation, walking meditation, sleeping meditation. There are so many things. So if anyone is good at it, we can always teach them mindfulness techniques or grounding techniques, where they can just spend half hour of the day to observe, internalize themselves rather than concentrating on what's going on around. So at the end, what will make you happy? It's myself, my goals, the time I invest in all my relationships, and me having gratitude. So when things are going wrong or good, it is me. Okay. So even if you want to fight a situation, you need to invest time in yourself, take care of yourself. Mine is love marriage. There are many situations where I actually fight with my husband. It's very common. So when I was very, very, early initial days of my marriage, it was very common to fight because we come from different caste and all. So there was one day where I did not eat my breakfast, lunch, and it was almost time for dinner as well. I'm still not eating, and I locked up myself in my room. My mother-in-law comes and tells, mother-in-law, only son. So she comes and tells, "You want to fight with my son, right? Fight. You need energy, no? So first go eat and be ready to fight." Smart, no? Though mother-in-law, but she has given me smart advice, and I still follow it. So it is very important that we invest in ourselves. All right. So with this, I hope I am on time, completed whatever was asked to. So I
Yeah.
leave it open to discuss, and I will stop sharing.
Walls, whoever have any queries or doubts, please put them forward. She'll address it. Geeta will address it. Pravina, any doubts?
All clear.
Hi Geeta, this is Shanaz here. Lovely presentation. Thank you.
Thank you.
The thing is, like, it's if the relationship problem, like, okay, when we are befriending, it's a different thing. But when we are talking about it to a friend or someone who's going through the problem, I find it very difficult to get them to understand that they themselves are important, because they have been taking such a battering emotionally. I'm talking. You're not good. You're not this. You're not that. You are the bad person. To even for themselves to accept, okay, no, that is not the thing. It's the relationship that's the problem. Is very difficult. I mean, I find that very difficult to handle it when I'm talking with it to my friends.
Okay.
And
all right.
yeah, but I'd like to know how to go help them on that. And that's my main concern there.
Okay, so correct me if I'm wrong. Your friend is actually blaming herself that she's bad and she's not right and she's taken the wrong
She's
decision.
already, I mean, all the time, that from her husband and from her in-laws and her own children, it's been like, you are the one wrong. Anything goes wrong, she's the person to blame, whether she's connected to that or not.
Yeah.
So like, it's become, okay, I'm only bad. It's only my fault. Normal abusive relationship, I should say. I mean, you can't give a label, but at the same time, I mean, that's what normally, I mean, that's the closest I can get.
Okay. Let's do a small activity.
Yeah.
All of us. Yeah. All right. Okay. All of y'all can just leave your iPads or whatever y'all are holding. Close your eyes for a moment. I'll not just take more than a minute. Close your eyes. So am I. And think about your best friend, just like whom she mentioned. Your best friend or your relation, your closest person. And now think about their recent problem, whatever they might have faced. And imagine how you have helped them. What did you do? At that point, how did you help your friend? What was your body language? What were the words you have told? How did that comfort? Right? Okay, so you can just open your eyes and tell me, did that make a difference to your friend or the closest person?
Yes.
Yes, somewhere you might have just been there, not even spoken a word, but that's so much of help to that person in need, right? Will you be doing the same with yourself when you are in that trouble? No, you don't treat yourself like that. The way you treat your friend is with so much of warmth, kindness, and all, but when it comes to yourself, you can't do it. So it's very important when you start treating yourself the way you treat your friend. That is self-compassion. So that is the first thing which I would suggest has to be followed by her. And now when she has so many people telling so many things, she needs to practice disconnection. Physically being present, but psychologically absent. But most of the time I ask to do it the other way around. In relationship, for a relationship to be strong, it's very important that we are psychologically connected and not physically. So that is how the long distance relationship also functioned very well, especially during COVID time. But in this case, it's important that she psychologically disconnects, especially when you are having, extended family, it is common. So I involve myself somewhere. It's like desensitizing myself. Ah, jab dekho wahi. That's how our language is. That's how he talks. So I am accepting that is how it is going to be. And suddenly, if she or he is making a change, oh wow, then that becomes easily acceptable. And this is not something that I am telling out of the theory knowledge or the bookish knowledge. That's what even I do it. I come from a strict Madaliyar family. I'm a Telugu girl married to a Madaliyar. So my mother-in-law, whenever my friends would visit, right at the door itself, she would stop them and take whatever it is there and she'll tell, Geeta, come, your friend has come. And I'm supposed to sit there in the waiting room, talk to my friend and go. That's not how I was. Initially, I complained to my husband, made a mess. And then I said, yeah, she's like that only. So next time, whenever my friends would come, even before she would call, I would run to the doorstep. I don't know what happened, what pity she felt. Mama, wa. And then she would call my friend inside up to my bedroom. Oh, wow, that was a blessing. So I desensitized myself and accepted the fact. And the best thing is, I kept myself involved in most of the work that I do apart from being a part of it. So that's one of the solutions. I hope it helps, Shanas.
Yeah, thank you.
Yeah. This is actually the first time I'm giving a presentation apart from psychiatric or clinical psychology subjects most of the time. So I don't know how well it was there up to the help or the point that you all want, but please, no problem. I'll try my best.
Yeah.
Is someone asking anything?
Murthy, you're not clear. You're too feeble, your voice.
Can you hear me now?
Yeah.
Yes.
Okay, I put the mic away, I don't know why. So anyway, the doubt that I have is something like this. Some of the calls that I hear, that I receive, when we come to the question where, did you take a doctor's help, did you go to a doctor or something? The answer that I constantly get, believe me, it never was different. They say that I go to a doctor, the doctor hardly listens to me for 10 minutes and gives me a medicine. Now this medicine, I use it for some time, but this medicine is only putting me to sleep. And then when I get up, I'm again with the same thoughts and everything. So the doctor is not actually helping me to come out of it without a medicine, and that medicine is not solving my problem. Why does this happen that they're given a medication instead of listening to what it is and probably try to help them other ways of coming out of the situation. I don't know. I'm asking out of innocence. I'm not questioning the psychiatry process. Please don't mistake me.
No, not at all. Not at all. I again wanted to do an exercise, but I'm sure I will be fired keeping the time in view.
No, go ahead, Geeta, go ahead.
Okay. Again, so we are speaking about the thoughts and disturbance what your caller is having. Ask them to do the simple exercise along with you. What I'll do now is, for the next 1 minute, I'll keep a timer. All of us, what we will do is, we have guys, we have girls, so I can't think about a rose. Okay, we will think about a camel in a desert. Can we?
Yeah.
Yes. All right.
Yes.
So here we
Yes.
go. Close your eyes, all of you all, once again. I'm not closing because I have to watch you all, because I've done this exercise many times. Close your eyes. Think about a camel. Just imagine a picture of a camel on your mind. All right, so here we go. For the next 1 moment, you will think only about the camel. And in case if the picture of camel is out of your mind, start counting how many times the camel is missed out of your mind. Okay, so here we go. Start. All right, stop. And then open your eyes. And please tell me how many times you'll have lost the camel.
About 40 times.
40 times. How about others?
Many times I couldn't count.
I did
Many
not.
times, even I couldn't count.
No,
I did not.
I didn't lose anything.
I
I
thought
just- I could remember exactly seeing it maybe probably 6 or 7 times really. I mean, I could, that's all.
I
It's
just
very
lost
difficult.
one.
the camel was also okay, but it was
Yes, you can figure out only that, yes.
Mind was wandering and couldn't concentrate.
Right, it was chewing, it was doing various things.
Okay. Okay.
Yeah, sitting and somebody falling down from it. I have seen that.
Oh, okay. So many things. Okay. But still, many a times you have seen that the camel was not there on your mind.
Yes,
Yeah.
yes.
yes, it
Definitely some
happened.
problem with all of you all, huh?
I mean, to admit, I was only conscious about when is Geeta going to say it is over. So those are the times I missed the camel. And then, halfway through, I started seeing many camels, not one. I don't know what is that problem.
All right. So if I tell that there is some problem with you or your mind, I am a stupid. That's a fact. If there is anyone on this earth who is giving you medication to control your thoughts, that's not true. There's nothing here or any medication that will control thoughts. Medication do 2 simple things. I mean, I'm just giving you a broad view. It's not that only 2 simple things. What the client can actually see is making them active or making them at rest. These 2 are the things which would be immediate relief based on the situation. There are other severe disorders where medication does work. So why these medication are either increasing your serotonin, dopamine levels. Most of them work with serotonin. That's the neurotransmitter for depression and anxiety. So they either increase it or decrease it, which will either put me to sleep, and I wake up, I'm again with the same thoughts. So medication is not the solution. If the patient is that very, in a such severe state where they have been sleepless for 2-3 days, I do not do counseling. I immediately call the psychiatrist and tell boss, isko sona hai pehle. So they go back, they rest ample, and then they come, because at that stage they are not even in a position to listen to what we are talking. And what you and I are doing is talk therapy. We are trying to heal them by talking. So no medication would work to put our thoughts to control. You cannot. But one thing which you and I can do is control our reactions to the thoughts.
I don't know. I mean, that's the complaint that I get to hear, that, I become an addict of medication and nothing is coming out of it. Yeah.
Yes, that is again one other important thing with psychiatric medication. If you're having any caller who is taking psychiatric medication, please do mention that they cannot start by their choice and end it by their choice, most importantly. Psychiatric medication is always a course, will be given slowly, reduce and then slowly increase, and then it reaches a higher stage and then we slowly taper it off, even when the symptoms are zero. Because you are feeling absolutely fine, I withdraw medication. It doesn't happen like that. So that is one thing with psychiatric medication. Should be always taken and withdrawn with the consultation of your psychiatrist. If they are really in vulnerable state, please do suggest them to see a doctor or a professional help, whatever.
Gayatri, do we have time for more questions or do we go forward?
Do you have a question?
I'm done.
Yes, Katri.
Anybody else has a question?
Yes, Katri, I want to.
Yeah, please go ahead.
Yeah.
Last question.
Yeah, when they call, they get stuck at some place. How could he or she do this to me? They cannot come out of it. I was so good to them. I was so good to her. I did so much, this much. We were so good together. We stayed for 5 years. So they don't accept that person. How can they do this to them who were so good in the relationship, so giving? And in spite of telling, they cannot accept or digest the thing that someone has left them. That is the big question most of them ask.
Yes, that's a very, very common question which we actually come across. If I was the person handling, I would say, that person did not have sense. He has done so much. What are you doing to yourself? In a simple statement, but the truth is, I need to know how I'm handling at that point. How can he do? He is not in my control. So I would tell that is not something that you and I can control. Even in a committed relationship, you can only ask, but you cannot, convince them to do something. You can only ask them, you can only request them. And in a relationship which is not committed, definitely the person is not in your control. So what he has done is over. But what you're doing now to yourself is what matters. How can he do? You and I cannot answer, and would not suggest he answering it and going back. That is the reason I spoke about giving a closure. It's important that you close it, giving your response. You give whatever closure you want. You fill in the blanks. He was an idiot. He was not fit for me, blah, blah, blah. And then close it nicely so that you're ready for the next one. And one other thing, most of the time, you see the relationships are somewhere around 6 to 3 years when there is a breakup, if you just inquire a little more. And that is what we call it honeymoon period. Honeymoon period is, not that 1 month, 2 months. No. Most of the time it's 6 months to 18 months. Rare cases, it goes up to 3 years. And this is what is the honeymoon period. And when the honeymoon period is over, that is when the actual drama begins. But that is where actually you start living with the person and you start being in the relationship. That is what we look at. So if it is less than that, it is difficult because, initially everything is so beautiful. Every time coming with a gift, you have a new place to explore and things are really different. So somewhere within that time when it's all exhausted, that is when you be actually yourselves. That's one other thing.
Thank you, Geeta. Thank you so much.
Yeah.
So,
Thank you very much, Geeta. Very nice of you to have taken time on this Sunday. Thank you so
Well,
much.
thank you. My pleasure.
And Geeta, we wanted the slides. Can you share it with me later on? The slides of your talk.
Slides?
Yeah, just the maybe a screenshot. I took some. I think initially I didn't take.
I will send the matter.
Yeah, I'll get in touch with you.
Sure.
Yeah. Thank you.
All right. So I will take leave.
Thank you so much,
for the
Geeta.
opportunity.
Thank you. Bye-bye, Geeta.
Thank you. Thank you,
Thank you.
Geeta.
Bye.
Bye.
For sharing your own experiences. That was really
Thank you
great.
so much.
Thank you.
Great,
Thank you. Bye.
Super,
great
Geeta.
talk.
Bye.
Bye, Geeta. Hi and bye.
thanks, Geeta.
Bye. Bye. I will talk later, Madhuri. Bye.
Yeah. Yeah. Your smile is so good. Yeah.